digoxin, where you have to have a true heart rate. There. And if I was concerned with hearing any bruise, I would listen to the same spots with the bell of my stethoscope. So now, with your permission, if that's okay, I'm going to inspect your abdomen. So if I could get you to lie down, Mark, that would be great. Thank you. Again, have you been experiencing any nausea at all, Mark?
No, nothing.
Not even when you had your migraine?
Yeah, sorry about that. Yeah, when I had the migraine, I was nauseous, but then it passed.
Okay. I wouldn't have had any bowel movements at all. And when's your most recent bowel movement, or any issues with your bowels?
No, I had just had a formed bowel movement this morning.
Okay. Any changes in, or any pain in your abdominal area that I should know about?
No.
No, and nothing when you have bowel movement. Okay.
No.
And any changes in your appetite?
No, in fact, it's improved since I've been in the hospital.
Wonderful. That's really good news. So I'm gonna keep you laying flat, and I'm gonna take a look from the side. Okay.
Yeah, no
So
problem.
I'm gonna pull this back, Mark. Okay. There. All right. So I'm just gonna get down, and I'm gonna look at it this way. So I'm just looking for symmetry. I'm looking for any pulsating masses. I'm actually looking for masses as well. Those things I would try to avoid when I'm palpating. Okay. Now I'm going to take a listen. I'll just give you a little explanation about that. So I'm going to listen. Your abdomen has 4 quadrants, and I'm going to listen to the right lower, right upper, and left lower. I'm going to listen to each area at least 5 seconds. What I'm looking for is vowel sounds. So I'm looking for an average of 5 to 30 a minute. That would be normal. If I didn't hear anything, I'm not going to panic. Before I determined that there was no vowel sounds, I'd listen to it for 5 minutes a quadrant, if you can believe it. Okay? So I'm just going to start now, if that's okay? You got good vowel sounds. So before I palpate, I'm just going to do an additional inspection. I'm looking for any wounds. I don't see any wounds. If you had any dressings, I would change those as well. From this direction, I don't see any lumps and bumps, but I may feel some of those on palpation. If I were to see any, I would not palpate in those areas. And I see no cyanosis and no pallor. With your permission, I'm just going to do a bit of light palpation.
Yeah.
Okay. So light palpation is just about 1 centimeter deep. Okay. You tell me if you have any tenderness. Okay. How's that work?
No, everything's great.
Okay. So I'm just going to do a bit of deep palpation, and that's 5 to 8 centimeters. Okay. But again, I'd be avoiding anything that was pulsating, any tenderness, any masses. No. Still good?
Still good.
Okay. All right. So at this time, I'd just like to ask you about your voiding patterns. Have you noticed anything different? Have you been voiding well?
Yeah, I've been voiding well. It's been a clear yellow color.
That's good. So if you had a Foley at this time, I'd be assessing the Foley. I'd be making sure it was intact. Our policy at the hospital is to change it every 30 days, so I'd ensure that you had a new Foley if you needed one before you went home. I'd note the color and the clarity of the urine, and I'd also make sure that your voiding patterns were what they should be at your baseline. Okay? Also, if you had any ostomies, ileostomies, or ileoconduits, I'd ensure that those were intact. I'd obviously assess the stoma. I'd want to make sure the dressing was dry and intact. I'd assess the output and ensure again that it was the same as the baseline when you came into the hospital, okay? So just so you know, at the same time as I was listening to your bowel sounds, I listened to the vascular sounds of the aorta, iliac, renal, and femoral arteries, and I'm listening for a bruit, and I didn't hear any of those, and I would have let you know right away.
Okay.
So if that's okay, I'm going to cover up your abdomen and then just take a listen to your legs, or take a look at your legs and your lower extremities, okay?
Sure.
All right, thanks, Mark. And you'll see, Mark, this mimics the assessment of your upper extremities.
Okay.
There, okay. So what I'm looking for at this time is I just want to ensure that you have equal hair dispersion. I'm feeling your legs, and I want to make sure that they're warm and dry, which they are. I'm noticing no cyanosis, no pallor. I'm noticing no lumps and bumps. Now what I'd be looking for is any wounds as well. I'd be assessing those and dressing those. An important thing for you will be me assessing whether or not you have any edema. When you came in, you did have some pitting edema, but I'm going to note that you have no edema at this time, so that's good. We've been treating you well. There. I'm going to assess your popliteal pulses. These are a little more difficult to assess, so I might use a Doppler for those. But those are equal and strong. I'm going to assess your posterior tibial pulses as well. Those are equal and strong. And your dorsalis pedal pulses. And those are excellent. And those are equal and strong. And if I had any concerns again, I would use a Doppler. Now I'm going to do the same thing I did to your fingers. I'm going to press on your toes. What I'm looking for is some blanching and return of color. Again, just to assess cap refill. And it's less than 3 seconds, so I'm happy with that.
Okay.
Okay. Thanks, Mark. At this time, with your permission, I'm just going to get you to sit up.
Yep.
And I'm going to listen to your chest. Okay? Thank you. You're all tangled up.
Yeah.
Just move forward a little bit, please. Okay, thank you. So, again, like before, I'm just going to listen to your posterior chest. I'm going to just ask that you take a deep breath every time I move my stethoscope. Is that okay?
Mm-hmm.
All right. Now I can see right away that your spinous process is in a straight line. And I just want to quickly check for symmetrical chest expansion. You take a deep breath for me. Okay. And another one. Okay. I'm noting no cyanosis and no pallor on your back. And I'm just going to palpate again just to ensure that your skin is warm and dry. And I'm looking for tenderness and lumps and bumps again. Anything?
No.
At all? Nothing
No.
causing you discomfort?
Nothing.
Okay. So I'm going to auscultate your posterior chest. Like I said before, please take a deep breath every time I move my stethoscope. Okay. Okay, I'm listening laterally as well. Okay. So again, Mark, like when I was listening to the front, I'm listening for any wheezes or crackles, which would indicate any adventitious sounds, and I don't hear any. I hear great air entry to the base, from the apex to the bases bilaterally. Also, if you were immobile at this point, I'd be looking at all your bony prominences to see if there was any skin breakdown, as well as if you were incontinent, I would check in to make sure your coccyx and your peri area weren't broken down or reddened, and ensure we take care of that appropriately. Now, before you're discharged today, Mark, I'll be giving you some pointers about how to manage any type of fluid overload again. And that will include having a low sodium diet as well as monitoring your fluid intake, which will be important. And also I'm going to give you a few little tips to ensure that you can note if you're starting to fluid overload again. And one of those things will be weighing yourself every morning. And if you notice a big increase in your weight, and it's not something that, if we're looking at 10 pounds over a couple days, That's a lot of weight, and obviously not from food intake. So that will give you an indication, as well as noticing additional swelling in your legs. Okay?
Okay.
Now, before I leave, obviously I know you're alert and oriented and you wouldn't have any problems with this, but I want to make sure there's no environmental hazards. So I'm going to look and see if there's any cords that have fallen on the floor, any blankets that have fallen. I want to make sure your shoes are within reach, as well as your phone. I'm going to make sure the bed is obviously in the lowest position, and make sure that there are bed rails up. If you needed the call bell, or if you need me, you can use the call bell. You don't need bed alarms on, but those are there in case if you were unsafe to mobilize on your own. And before I leave, double check that there are suction and Yonkers and suction set up for the next nurse. Okay. So before you go, do you have any questions or any concerns that you might have?
No, nothing.
No.
Thank you so much.
Okay, so I'll be back with your discharge papers as well as your discharge prescriptions, and then we'll go over those medications together.
Sounds great.
That sound okay?
Yep, thank
Okay,
you.
thanks, Mark. Thanks for everything.